Brazilian digital space. Today I'll be guiding you regarding how to carve the permanent maxillary center incisors. So let us start with the carving of the permanent maxillary center incisor. Today we'll be carving the permanent maxillary center incisor. Before carving the permanent maxillary center incisor, you'll need to have armamentarium ready for that. First of all, we need the wax block and we'll be carving the maxillary center incisor on this wax block. To carve on the wax block, we need to have a sharp instrument, and we have this instrument called as the Lecron carver, and you can see that it has two sides, one flat blade and the other a spoon-like area. We'll see what are the different functions of each later on. We need to have a metal scale so that we should be able to measure the correct crown length and the root length, as well as the mesodistal and the labilingual sides. And to do that, the correct measurement, we need to have a divider by which we can align with the scale and then take it to the wax block so that the correct measurement can be carved. And finally, when you carve the teeth, at the end of it, we need to polish it well. And this is the cloth that we use to finally polish the carved tooth. And this is the carving cloth. And of course, we have a sheet here where we collect all the wax shavings, and this is called as the Macintosh sheet. So there we have it, all the armamentarium necessary to do a good carving. First of all, you take the wax block in your hand, and as you can see, sometimes there might be some imperfections on the wax block. So what you can do is you can just run your carver like that, so that all the imperfections are taken off initially before you start with the carving. So make sure that all the imperfections on all the sides are taken out like that. Make it somewhat smooth. Okay. And next, what I'm going to do is I'm going to divide the wax block into a crown length as well as the root length. The crown length is 10.5 centimeter and the root length is 13 centimeters. Now take the wax block and we are going to divide it into the crown length as well as the root length. The crown length is around 10.5 millimeters and the root length is 13 millimeters. So you can see here that I have divided it into the crown length, that is around 10.5, and the root length, that is around, from here it's around 13 millimeters. But always make sure that, or you can always give at least 1 millimeter extra to make allowance for the carvings that you're going to do later on, so that it does not diminish in size. Okay. Now after you are divided into the crown length as well as the root length, what I do is I give or make a line in the center, almost equally dividing these two sides. I make a line in the center. Now you can see that this is the crown length that we have taken, and from the middle, you know that the mesodistal width is around 7 millimeters here. So what I do is from here, from the middle, I take 3.5 here, and from here I take 3.5, totaling around 7 millimeters. I mark 2 points here. I mark 2 points. After I do that, I just give a divergent line from there till the incisal edge. I mark the divergent line from here till the incisal edge like that. Can you see that? So this is around 7 millimeters, and at the greatest it will be around 8.5 millimeters. So after that, I will reduce the wax from either side I will reduce the wax from either side, so you get the carving like this. So you can see that I have reduced from either side, from the divergent line outside, and I get a carving like this. So this is roughly the crown size as of now. Now what I'll do is I'll turn to the mesial aspect. Obviously I am carving the right maxillary center incisor. I've turned to the mesial aspect. Again, already the wax block has been divided into the crown length and the root length, and I have also marked the center middle line. Now what I do here is from the center, the width here is around 6 millimeter. The width here is around 6 millimeter. So from the center I measure 3 millimeters here, 3 millimeters here, and mark it. So either side I am marking 3 millimeters. And from there I will be carving out the labial outline and the lingual outline. Now when you carve the labial outline, make sure that the crest of curvature is in the cervical third. This is the cervical third. The crest of curvature or the height of contour should be in the cervical third. And after that, from the middle till the incisal, there's an even curvature till the tip. And here you can see that again there is a crest of curvature in the cervical third. That this is your cingulum. There's a crest of curvature here, there's a bulge here, and then there is a concavity, there's a slight concavity, and this will finally meet with the line here that is almost in the middle, almost coinciding with the line that you have made here. So this incisal edge will be coinciding with this line that we have made. Okay, so make sure that always this incisal tip should be coinciding with the midline. So here make sure that the crest of curvature is on the cervical third, both on the labial as well as the lingual aspect. Now what I have done is I have carved out the wax from outside this line that we already made. The labial outline, I have just cut out the wax from outside this line, and again from the lingual outline also I have cut out the wax. So we get this shape for the carving. So this is the carving shape that we get after carving out the labial outline outside and the lingual outline. So make sure that you cut it parallelly. So that both sides look the same. Cut it parallelly so that both the sides you get the same effect. In case there is some sort of confusion, you can also mark the labial outline here and the lingual outline here and join these two so that you get a parallel effect. Now take a look at the incisal aspect now. You can see that both the labial aspect and the lingual aspect are almost having the same width here. Now the next step is we are going to reduce the lingual size. We are going to give a lingual convergence. That means that I am going to cut both these sides. Take a look at this wax carving that I have made. You can obviously see that I have made a lingual convergence. I have cut both these sides so that I can get a lingual convergence. So the labial width is more than the lingual width now. The labial width will be more than the lingual width. And if you look from the incisal aspect, you can see that it is somewhat triangular in shape with the apex almost at the cingulum. Now staying with the crown, you can see that we already made the crown, and we are making the right maxillary center incisor. So obviously this is the mesial aspect, this is the distal aspect. We know that the mesio-incisal angle is almost 90 degree, while your distal incisor will be more rounded. So what do you do to make this more rounded? Either you can use your carver to round it off, or use your polishing cloth to round it off, and the effect will be like this. You can see that I have rounded off the disto-incisal angle. So what I've done is I used the cloth, I have just rubbed it like this, so that the disto-incisal angle has become more rounded than the meso-incisal. We are not touching the meso-incisal angle. This is almost 90 degrees. So now we can see that almost the crown is complete. The crown is complete. We have carved the full crown of the permanent maxillary central incisor. So this is how it will look. But before that, you have to make one more landmark, or you have to give a lingual fossa. So what I do is, you use the other side of the carver and scoop out the wax on either side. And you can see that we have obviously a marginal ridge. You can also have the W-shaped lingual fossa here. So lingual fossa, the marginal ridges, you can make it by running up the carver up like that, and slightly use the other side slightly to scoop off the wax like this. So we have made the crown. The labial aspect is clear, the mesial and distal is clear, and we have to make the lingual fossa also clear. So how do you do that? So what we can do is, you can use the carver, use this blade, run your carver on either side. You can run your carver like this from the incisal to almost the cingulum area, scoop out the wax like that, and again you can use the other side to scoop out some more wax. Don't overdo it, because remember that this is a shallow fossa. Okay, so now we have the lingual fossa also clear. You can see somewhat the M-shaped fossa, so that is also clear. So now the crown is almost complete. The crown of the maxillary central incisor is almost complete. Now what remains is making of the root. Now when you make the root, first of all, we already measured the length of the root, that is 13 millimeters. As I mentioned, you can always take a little extra, make it maybe 14 millimeters, and you have to carve, or you make an outline of the root on the labial aspect. And when you're doing it, you can see that obviously the cervical and the middle third almost it is parallel, while it is becoming, there will be a curvature at the apex. So there will be a curvature at the apex here. So now you made the outline of the root here, and now we have to cut on either side of this root. We have to cut on either side of the root to get the root outline from this side, from the labial aspect. Again, after you do that, you turn to the mesial aspect. Again, measure, you make the outline of the root. In such a manner that it is almost bulky in the cervical and the middle third, while it is becoming rounded off at the apical third, and cut on either side. So the end result is that you will be getting a root that is looking like this. So I have cut both the mesial and the distal aspect of the root on the labial, as well as the labial and the lingual aspect on the mesial side also. So this will be the end result of carving our particular tooth. So you can see here, obviously this is the carving of a left maxillary central incisor, a finished maxillary left central incisor. Obviously what I shown you earlier was the carving of the right center incisor. So there you have it, almost the root is complete now, and the crown is also has been completed earlier. So what I'm going to do now is, here I'm going to mark the cervical line a little more clearly. So I'll just mark the cervical line on the label aspect. I'll just make a semicircle with the apex pointed towards the root, Turn to the mesial aspect, the cervical line will be having a little dipping towards the incisal edge. Again, coming back up on the lingual, it will be having a semicircle with the apex towards the root. Again, it dips on the distal aspect, but not as much as the mesial. It will be dipping a little less, 1 millimeter less than the mesial aspect. So what I'll do is, I'll just carve out the cervical line also. So what I do is, actually I'll be carving from the root till the cervical line. So you should be able to get a raised cervical line. You get a raised cervical line. It should feel like the crown is fitted over the root. So that is the effect that you want to have. And you can go for the final polishing after this. Use your polishing cloth. You can rub it. After taking off all the irregularities, you can rub it well. Polish it. This is how we are going to polish it. Give it a good rub so that the polishing effect is seen. So this is the finished carving of the maxillary center incisor. This is the label aspect with the crown and the root. This will be the mesial aspect. You can see that the crown and root again has been carved. The lingual side, you can see that the lingual fossa is also carved. So all in all, this would be how your finished carving should look like. So this is the finished left maxillary center incisor. You can see that every aspect has been carved. You can see that the cervical line is now clear. Cervical line, when you are carving, make sure that the labial aspect, the apex should be pointing towards the root, and when it comes to the mesial aspect, you can see that the apex should be pointing towards the incisal aspect. The apex should be pointing towards the incisal aspect. And turn to the lingual aspect again, it will be, the apex would be pointing towards the root, and again towards the distal, you can see that the apex would be pointing towards the incisal aspect. The difference between these two cervical lines is the height from the cervical. The cervical line here would be 3.5, that is dipping from here to here, it will be 3.5, while for the distal it will be 2.5. This is a common observation of all the tooth. Usually the mesial aspect will be having a greater depth of the cervical line, and the distal will be having a lesser depth of the cervical line. So you can appreciate the carved tooth. This would be the left maxillary central incisor. Left maxillary